Well, I've been a chiropractor for 15 years. That's my background. And I got into chiropractic. I guess I went to school about 19 years ago because I love kids. I love helping kids. And it was always my passion to help them become all of who they can be. And when my daughter was diagnosed with ADHD 3 or 4 years ago, that put me on a path to finding a natural, safe, effective solution for her, which I did. I ran across the research on neurofeedback and how good that was for ADHD. And so it was really a fit. And from there I found out which type of neurofeedback I wanted to do, and led me to BrainCore, among other things. It's the only one I found that consistently, every time in the beginning with everybody that we end up doing neurofeedback with, we do a brain mapping evaluation, so there's no guesswork as to where we're going to be working. It worked great for my daughter, and I knew then, like I knew when I wanted to go into chiropractic 15 years ago, that it was a mission and a passion for me to help kids in this way. It's just not well known enough out there. And it's my mission to bring the news to people and have as many people as I can possibly think of to know that there's a safe, effective alternative to medication with regard to this. And they did a great story in WNC Woman, the article somewhere here on the website you can link to and read about it. But I just truly believe that there ought to be another first choice that we reach for when giving our children the tools they need to succeed in school and in life. Giving them medication, while it might be a temporary answer, and I'm not saying that's necessarily bad, there should be another less invasive choice that we reach for first that often solves the problem, as it did with my daughter. So when looking at kids with ADHD and even adults, we have different options that are recommended to us, and I'm such a strong believer that we should always reach for the thing that, number one, is going to work the best, of course, but let's not do any harm. Often always medications have effects. And I like the saying that the only difference between an effect and a side effect is marketing. So it wasn't an option for me in looking for a solution for my daughter. And I can see, and I see kids every week that is what they're reaching for. And this works with kids if they're on medication or not, just so you know that. And living here in North Carolina, it's amazing, but if you look at the different states, we in North Carolina have the highest diagnosis rate of kids with ADHD than any other state in the country. In fact, at some point, 11% of the kids between age 8 and 17 will be diagnosed with ADHD. And the vast majority of them, what's recommended is medication. And they always have effects, and they have many effects. Some of which you like how they're acting, and some of which not. And some of them we don't even know because we don't have the long-term studies. But one thing's for sure, to me it's not solving the problem. It might be something you're needing to do, and it might change things in a positive way. But then when you stop taking it in a year or 2 or 3, are the problems still there? Most often they are. And that's what I mean by it's not a solution. It might be a short-term choice, but it doesn't solve the problem. Whereas neurofeedback actually changes the way the brain works, and to me is a solution, or at least it has been for my daughter.